Somebody better say something sooner, I'll make the cow go.
So did the researchers ask them if they were right-handed or left-handed? Does that make a difference?
They did not, however, because of the language thing, if they were able to participate and explain their confabulations, or if they're able to answer the questions. If they were left-handed and they had right hemisphere damage, then they would most likely have aphasia where they're not able to speak. Any other questions?
And there's also the fact that people with standard right-handed people tend to be fairly similar in where things are centralized and located in the brain, but people who use their left hands to a greater or lesser degree often have different brain organization. The language thing is one thing. Sometimes left-handed people, their language is really centralized in the right hemisphere, but more often it's kind of split, it's more distributed. So it just throws another source of variability in, and when you're trying to figure anything out, it's good if you can get rid of as much variability as that you're not trying to explain. So that's probably also part of it, although certainly if you can't even interview people, it's pretty tough to do the study, or to have the information in the chart.
I'm just surprised that this, well, I mean, they didn't say it was only the arm, but they only mentioned the arm, so I'm surprised that it wasn't, you know, the whole entire side of the body.
It did seem interesting. What I came across was that most of the time it is the arm. And I know a couple of videos that we've watched in the past also talked about the people who had the left arm paralysis, and they were going through that therapy where they had their other arm tied down to try to, you know, rebuild connections for that. So I'm not sure exactly, but like she said, just with the variability factor of it, they may have chosen just to focus on that.
Oh yeah, I don't remember if they mentioned that, anything about that.
They didn't.
If they only picked people with arm issues.
They did say it was for arms.
For arms.
Because,
okay.
Yeah, because I know that's what they said for the procedure that they followed for all the patients.
That makes sense. Because you would expect the damage to be in a different place for a different part of the body. So then you have yet another thing that you're trying to take account of. If you've read The Man Who Mistook His Wife for a Hat, anybody in here looked at that? There's a copy of it on the Blackboard site, and there's a chapter in there about a guy who's, I forget, it's very short, almost all the chapters are very short, and he is like, would wake up in the middle of the night in the hospital screaming because there was this horrible hairy thing in his bed, and it was one of his legs.
His leg.
And he would throw it out of the bed, and hence fall onto the floor. And he'd be on the floor like freaked out when they would come in to see what's the source of the racket. And it was because he had gotten so scared of this leg that he threw it out of bed, and of course that meant that he was thrown out. And he'd be on the floor and he had no idea why he was there or anything. So it really is a bizarre dysfunction of the sense of self. It's really can be very, very, very powerful and convincing. It's like it's attached to you.
Oh, I guess, I mean, and so they would come up with stories, and that's kind of like the nestic versus non-nestic confabulations. So with this one, it's the non-nestic confabulation. They come up with this story like, well, how do you have your brother's arm? And then they would go through this whole thing, make up this wild story about why their brother's arm is attached to their body, even though their brother lives in like Utah or something. Yes.
Well, so like you said, if the researcher told them like, no, it's attached to your body, and they were like, oh, okay, I understand that, like after that, would they just like forget? Or would they still know?
Yeah, you know, it doesn't seem like it. I guess they just, you know, they would look at it because it was like a repetitive thing. So maybe they would forget, or maybe just as they go on, maybe they just accept it. Like, oh, I guess so because it's there. But I think in the future, like they still did not identify with that arm. So it's hard to say about that.
I also think they mentioned that it was more common right after the injury, and then sometimes it self-corrects.
Yes.
So they grow some other pathway that made up for it or something like that, and then they be okay, but the arm again, oh, right.
Yeah, I think some of them said that like after a week or a couple of weeks. Some of them were much more permanent, but most of the time it did self-correct. So it could be kind of like those people who were learning how to reuse their arm after hemiplegia. Yes. You still have a question?
Oh, well, I was going to say the same thing because
Okay.
I feel like if they were just told that is your arm, I feel like it would still be a delusion to them. Like it didn't correct itself because you can tell me it's my arm, but how do I know it's my arm?
Right. Maybe they just couldn't come up with a plausible explanation at the time. They're like, well, I guess it's attached, so I don't know what to say. I'll just say okay.
Is there any known treatment that can, for those people who just don't believe that it is their body part, is there any known treatment to combat it other than just actually amputating it?
So they will not amputate a healthy limb.
Right.
So I do not know, but I know like I didn't look into that, but I know in the previous video that we looked at, they talked about the therapy for people with hemiplegia. So I would imagine it would be similar to that. And it did talk about kind of correcting itself over time. So I'm not sure. But the people with the body identification disorder, that's different because they have it their whole life. They experience that their whole life. And again, because they will not amputate a healthy limb, a lot of times those people tend to damage their limb so that they can have it amputated.
Do you know if there are repercussions for that if you're damaging a healthy limb? Like, obviously they
Is
have
that
to
illegal?
amputate it now, but
Right.
are there any like...
I don't know, like maybe your insurance won't pay for it. I don't know. Yeah, I don't know. Because it would, I guess you would have to like press charges, but if you don't, like if you're like not gonna claim assault against yourself, maybe not. I don't know.
In that video, as far as the man ultimately damaging his leg and having it amputated, was there any type of like, did he suffer anything afterwards? Like, okay,
Oh, no,
well, I can't walk
was
now.
Happy. He felt
So he
much
felt completely better, even though he really kind of
well,
made
he
it
just
to.
got like a prosthetic.
Yeah, I can't even see on how that would be comfortable.
Isn't that crazy?
Yeah.
I mean,
Yeah,
sorry.
that they
that's
would
unprofessional
completely
comment on
prefer
Well, I'll
that.
say it. That's crazy.
It's so hard to relate to.
That his leg was a prosthetic, then like, you know, could you just solve everything by just being like, oh yeah, no, we replaced your leg and it looks good.
Well, that's a really good idea. Yeah, I
But
wonder.
there's a lot of, I don't know, I feel like there'd be a lot of problems as far as like IRB type of approval. Like, please like try to approve lying to a bunch of people and see what they do. Like what if they try to take it off? Like if it's prosthetic, you should be able to take it off, right? Like what would they do in terms, you know what I mean? Like I feel like there'd be a lot of like
Right.
backlash coming back to
The
that.
new and
whether it would get
improved
approved.
prosthetic.
Yes.
I think
long-term
it's
line.
probably, if you could frame it such that if we can convince people that this is a prosthetic, they're much less likely to hack it off with an axe. I mean, I feel like you might be able to convince the IRB, and it's sort of the lesser of two evils type of situation, but it probably depends on the IRB.
Well, and I know this is totally off topic because this is not what the article is about, but the BIID, it's interesting because they know that it's theirs. They don't have confabulations about it. They just don't identify with it. So they don't think it's somebody else's leg. They know it's theirs. It just bothers them because they don't feel that sense of self. They don't identify with it being their leg. It's just a leg that's attached to them, rather than this kind of crazy confabulatory thing like oh, that's somebody else's leg attached to me.
So that suggests that there's like different parts of the brain that contribute to all these different facets of our experience of ourselves. That is so amazing. Wow. So you can believe the leg is yours,
but not identify with it.
but it's like a hated aspect of yourself, or a
Dead weight.
dead weight. Perfect. It's like dead weight, and so you want it off of you. It's holding you back somehow. It's like a millstone around your waist instead of your neck.
Yeah.
Or in the other case, you don't even believe it's yours. It's like it's not even attached to me. And they pointed out that it's attached to you, and they still don't believe it.
Yeah. Yeah, they're like, that's not mine. I don't know how it got there, but it's not mine. I think she was first.
Sorry. So before when we were talking about emotion, we were talking about how it's possible that the amygdala is both involved in, turning on like a fear response and also kind of shutting it down. So I feel like with them, since, you were just saying that people who just have damage to the part of the brain that like identifies with the lag, they don't have confabulations, but it seems like the people with confabulations actually have damage to whatever part of the brain it is that might shut down false ideas,
Right.
And that
So,
might be exactly what they were saying.
so if you look at the difference between, so here's the green, that's the simple somatoagnosia, and then there's the yellow, so that's the somatoparaphrenia. So we know that the body map is in the parietal area, which is, right in here where the red and the purple damage is as well. But they were talking about how these other things, the medial prefrontal cortex is what helps distinguish the self from the world. So distinguish, your body or like yourself, your arm, or whoever you are, what you are, maybe how it can join. So we talked about the consciousness also as like a network. And it might be the idea that maybe the parietal area has to be able to communicate with this, this orbital prefrontal or medial prefrontal cortex, because that's the part that distinguishes it. So maybe it's taking your body map and then putting that together with your sense of self and being able to distinguish yourself from the world. And then those two things not being able to communicate is what says, what creates this confabulation. Whereas in the other ones, they don't have as much damage in this area here. So they don't have as much problem with separating the self from the world, but they do have the body image problem. So maybe if you point it out to them, they can say, oh yeah, I guess that part is attached to my body, so I can distinguish myself from the world, but it's kind of conflicting with, what their body image says.
Can you go back to the one with just the, no, the other direction. I'm sorry, I meant, can you show your brain thing that you made with just the bare minimum? Okay, that's the bare minimum?
That's
okay.
The hemiplegia.
Okay, and then...
That's hemiplegia plus neglect.
Okay, so that's where you start to get lack of attention.
Mm-hmm.
So your awareness of that area is damaged, and plus you can't move it, so you have less reason to pay attention to it anyway. So you're kind of losing track of it at that point. And then the next one, so that's where you start to get the idea that it doesn't belong to you.
Right.
Okay.
And then this is the area where you start making things
Making up stories. But yeah, okay.
So what's the neglect? What does that mean? I didn't get that part.
Okay, so the neglect is kind of like Peggy, where she didn't see the left side of the flower, or like they talked about that guy who didn't eat the left side of his plate, any of the food on the left side of his plate, because so the vision itself is not damaged, but they are not seeing or paying attention to the things that are on their left side. And the way they do this is the test that they used in this study is the line cancellation test. So there's like this piece of paper, and it's got all these little line segments on it, and then they're supposed to take another pen and go through and mark, so turn the line into an X, mark off the lines that they see or that they pay attention to or they recognize. And you'll see that down the one side of the paper, that left side has been neglected because they did not pay attention to it. However, if you remember with Peggy, when they told her, you forgot to draw the left side of the flower, then she could put her attention to it and say, oh yeah, I guess so, how did I do that? So it's not, right. So if it's not pointed out to you, it's not that they don't see it, or it's not that they can't see it, it's that they don't pay attention to it, so they're neglecting it.
That's why they call it neglect. So people shave only one half of their face, or they put on makeup on just one half of their face. again, in the man who mistook his wife for a hat, there's a guy who, or woman, I think, who would eat only the right side of her food. And so then they would come and turn the plate around, and she would then eat the right half of the half that she could then pay attention to. So be like, first she'd eat half, and then she'd eat half of the other half, and then she'd eat half of the other half. And there was also a story in there about somebody who learned that they had this condition, and I think they were in a wheelchair, and so they would spin themselves around
so that they could see
to
everything.
be able to determine what was really there. So like they would move their own frame of reference so that they could see what was in the outside world. So they were aware that they had the problem, but that still didn't make the problem go away. It's just mind-boggling. So if you have hemi, it always seems to be hemi neglect too. You never hear about any other kind of neglect. It always seems to be one half.
Mm-hmm.
It's like, and it's usually the left half that you're neglecting. So
the people with the somatoparaphrenia, they had more brain damage, right?
Yes.
So it just seems like they're more creative with. Sorry, bad bitch. So I'm just trying to think about how they become more creative without brain damage,
So, yeah, I mean, what do you guys think? Yeah.
Well, something I was thinking about was just basically like, this kind of seems counter to like all the other like brain damage like stuff that we're learning, but I feel like if you have more experiences and you're more intelligent, if you like just, you know, see more things, you might be more likely to be more creative, I guess, or confabulate more. If the like whatever part of your brain suppresses false ideas, you know, is damaged, then it's easier to reach out farther because like more pathways are strengthened. So it's easier to reach all the way to your brother even though he's not there, rather than just go with the simplest, like most here and now answer of, oh, it must be my own arm, even though I don't realize it.
Did they have them explain why they thought it was a rock or whatever?
So they did ask like a couple of follow-up questions, like, could you tell me more about that, or how is that so? But they didn't push them too much in their stories. It was more like a free response type of thing. So I think in regards to your question, I think one thing that's probable is that it's, you know, that disconnection of the self from the world. And if you're not able to tell who you are, because they see it in people who have long-term or the antegrade amnesia, right? Anterograde amnesia. The anterograde amnesia, they don't remember their past, but they feel kind of incomplete. So then they make up stories about it to try to give themselves an identity. Like there was a story about a guy who was like in the taxi on the way to the hospital, and the taxi driver was asking him about like who he was or something. And so he makes up all these different stories, like just all these things he's heard of, and just and the taxi driver, when he gets to the hospital, he's telling him, he's like, man, what happened to this guy? It's like, you know, I feel so bad for him because he seems like he's just been everywhere and he's done everything. And they're like, well, you know, it's not really true. He hadn't really done all those things, but he was trying to create a self. So, and I guess if you want to create a self, you're probably going to create the most interesting self you could. I don't know.
It's like the self-deprivation thing.
Yeah.
Start hallucinating.
You don't.
Getting any sensation.
You don't know who you are, so you want to try to make yourself fantastic.
Yes, you probably already mentioned this, but what part of the brain is activated when they're telling the stories?
They did not have them like hooked up to anything to monitor brain activity while they were talking about the stories.
Yeah, this is just an anatomy study, so there's no fMRI data available for this. Or if there was, they didn't talk about it in the...
And these, the tests were done with, within the time, it was part of just like the regular clinical exam that the patients had following their stroke. So it wasn't like everyone's going to come in and we're going to bring all these people together and this is what we're going to do. This was like a retrospective study that they collected old files. They collected all these files of people who had these different disorders. So like the collection, they said these patients are from over a span of 20 years, but they had at minimum these different diagnostics, and the clinical, the exam that they did is pretty much the same across the board because they are examining the extent of the damage from the stroke. So they're looking for hemiplegia, they're looking for neglect, they're looking for this somatognosia, and then that kid population. So all of those are like the standard measures that they would be doing following the stroke. Yes?
I don't know if this sounds inhumane or not, but I feel like those who have the hemiplegia, that they should sign up for some kind of like rescue group where they want this limb off, right? Okay, fine, but you have to use it in a way that saves somebody. Like if we have a baby burning in a fire, we need you to use that arm that you cannot feel to grab the baby. Obviously it'll be damaged and we'll take it off for you or something. Like a donor system.
That would be a different kind of flash mob. We need right away at this location somebody with serious BIID.
Yeah, so to clarify, that is BIID.
Oh.
That is not someone with hemiplegia or neglect. And that's what I was saying. It is kind of confusing because it is a little bit off topic from what this was. But the BIID is the people who were born kind of with this damage to their body image, their map. Whereas, and they were saying it kind of relates to this same thing, and they're showing damage kind of in the same area for the people with the somatognosia. So the hemiplegia is just the paralysis part of it, so not being able to use that limb. But like they said, a lot of times that can be corrected or it goes away.
It's a waste of a good arm, though.
Yeah. So instead of, if you have BIID, instead of putting your foot in a bucket of dry ice, you could
donate it.
You could be a landmine IED detector.
We need you to hop through this pole.
Yeah.
There was an episode of Grey's Anatomy where somebody had BIID and he used a chainsaw to just saw.
Was it the foot? He came in, he's like, this foot's not attached to me. So I saw that, I was looking for clips, and I saw that, and I was like, oh, because it's about the foot, and then like he's just coming in, he's like stomping, he's like, I'm sorry, I don't know what's happening, that's not my leg. But yeah, it was interesting.
Seems like they would have had an episode about this on House also.
Right?
Yeah. They didn't. You looked.
So who else is on deck that has to be? Okay.
With the hemiplegia damage that they were realizing that they only didn't have motor access.
Right. So, but I believe they also, part of it is that they had both motor and sensory deficits. Because I believe it said that they had somatosensory deficit. So actually, it did say for the hemiplegia, some of them either had mild somatosensory deficits or they had no somatosensory deficits.
People with just spinal cord injuries that are paralyzed, they probably wouldn't have the same thing with
That kind of like non-recognition. I don't know.
I wouldn't think so.
hallucinations, yeah.
Because one would assume that their cortex is still functioning normally, but if you think about, if you have, so this is actually something I never even considered before. If you have, let's say, paraplegia from a spinal cord damage, then one would presume that the sensory input to those parts of the map, the body map, would be seriously reduced because you can't feel that part of your body, nor can you, and you also can't move it. So it does seem like there'd be the potential for some rewiring in the brain, which I've never even heard of before or thought about. That's really an interesting perspective to think about. I wonder if something does happen up there.
Well, isn't that what, in one of the videos with Dr. Ramchandran, one of those where the people could, like, they would feel something on their cheek or something, and then they would feel it in their arm, they said?
Those people had amputations or
So,
missing limbs.
I wonder if that could still have, like, I feel like that might be what would happen, if, like, even if you still have the limb.
So you would feel things down there that weren't real? Is that what you're like, touching the face might cause you to feel something?
Yeah, or like some place that's close to like.
Yeah, I've never read about that. I wonder if that happens. Somebody should look that up. Not right now, though.
So yesterday, I kind of learned about how you can teach your Golgi body tendons, or body, yes.
The Golgi tendon organs?
Yes, to reset by stretching the muscle and then having the muscle contract while it's fully stretched at its maximum. Is there something that they could do like that to get these people to realize that this muscle is attached to your body, so it must be yours, kind of thing?
I mean, they did have that other type of therapy, so maybe incorporating more therapies. But I'm not sure because of the damage.
Because it's central damage.
Yeah.
That's also really interesting. I wonder if there are other pathways
That they could.
that are coming from the Golgi tendon organs. It does seem like they be going to the same part of the brain, though. I don't know. That's
because
interesting.
it's localized at first in the muscle, but then
Right.
it has to get back, the signal has to go back to the brain
Right.
in order for it to be remembered. I don't know.
But I don't know if it goes to the same place. If it goes to the same place it's damaged, it might not make any difference, but maybe it goes to a... That's something I don't know enough about. I stopped paying that much attention to motor control when they took it out of the textbooks for physio, because there's so much to teach anyway. So my knowledge of motor control is about 10 years old. So I just don't know if they're different, because at the time there was nothing about different destinations in the brain, because we didn't know anything about that stuff. So yeah, that's really a good question too. I'm gonna go ahead. Don't wait for me.
Yeah, just wait on everybody else.
Anybody else who is on deck?
Did you read on if it happened to be like what kind of like ethnicity of people like they had in common?
I don't remember if it talked. I don't think it talked about ethnicity at all in
The participant section?
Yeah, in the participant. So, and it was kind of interesting because the participant section of the article, it was just like, here's a table of demographics, and it did not summarize them at all. It was just like a list of people, a list of their age, and like a list of the type of stroke that they had, and then their gender.
They're all stroke victims, huh?
Yeah, they were all stroke. I think like 24 of them had a ischemic stroke, and like 2 of them had hemorrhagic strokes.
Why do you think that would be important?
I don't know, maybe some sort of genetic influence to it.
A what influence?
Genetic influence, being predisposed to it.
Oh.
I don't know, did they have some sort of family history with like of strokes or something?
Yeah,
I was wondering if there would be a cultural influence on the kind of stories that they had about where it was coming from. Like, whose leg is this anyway?
Yeah, they didn't include any of that.
So they do say that the brain rewires after spinal cord injury. I mean, now I'm looking at a couple of papers here. but it's not telling me anything specific without reading the paper, which obviously don't have time to do right now.
People that are paralyzed can recover in a sense, like over time?
Well, no, not really, because unless you can regrow the spinal cord, which currently we don't yet have the ability to do that because the spinal cord is unfortunately part of the central nervous system, and so it doesn't have the nice Schwann cells that allow the nerves to regrow in the periphery. So you still wouldn't be able to move or control your muscles because you don't have the cable that goes down there. But what they're talking about is the brain rewiring due to the changes in the input that it's getting, because it's gotten a lot less, it's getting less input, obviously, so it's doing some rearranging up there. But you still don't have any way to send move signals to the muscles. Like I said, the cable is cut. So. Yeah, I'm gonna have to look into that. That's really interesting.
Yeah.
Do they still feel the same way? Like if they look in a mirror, they'll still be like, that's not my leg, or that's not my arm, or something like that?
Yeah, that's interesting. I did not read about that, but it would make sense because when we talked about the sense of self, it also is related to recognizing yourself. So if you're not able to, if you don't identify with that, you probably wouldn't recognize it. Yeah, I didn't read about it. It was a good question.
Melissa, do you have something to ask or comment about?
I didn't necessarily have a question. I was just wondering, like because they feel like the limb is not there, it's like I wonder if like they feel like part of them is missing, like with the whole body identification. Like, do they feel like it's missing?
So like this thing is on me, but where is the one that should be there, kind of thing? Yeah, that's an interesting question too.
That is interesting because it seems like maybe that part of the body map has just gone missing more so. I did read one thing that was saying that there's people who feel like they are missing like an extra, like they have both their arms, but they feel like an arm is missing, which is also weird. But like, where's the third one? So, I don't know. I wonder, because if they don't identify with it, is it just that they don't want the thing that's there because that map is damaged? And if you don't identify with it, or if you don't feel like that's part of your identity, then maybe you wouldn't miss it. I'm not sure though. Does anyone else have any ideas about that? Yeah.
I think it could just be like, if that area of the body map is missing, maybe, so like either there could be just like one area that like, obviously there's an area that moves the arm, and there's an area that senses the arm, like the feelings from it, and then like possibly there's like a third area that identifies with the arm. And so they're like, if they think they're missing an arm, even though they have both, maybe they have an extra identification of arm area. And then like, on the opposing side, maybe they're missing the identification of the arm area for the people who don't have one. So they would feel like it's missing because they don't have that, that part of the map.
Yeah, I think that's very plausible, and it totally makes sense with the differences with the damage here, because if your map is kind of over here, you might have damage to your map here, but then this area down here is what's going to say that it belongs to your identity. So the connections between those, maybe the connections between those being damaged, or having this area here damaged, because maybe this area is where connecting these things. Yeah, that would make sense.
Yeah.
This reminds me a lot of like Capgras syndrome. I just keep thinking about that, in that they recognize that, you know, in Capgras, they recognize that these people look exactly like them. They just don't have that like emotional component, and that's what makes them feel like it doesn't belong to them, or it doesn't. I don't know, but I guess my point in that is we do sort of have some sort of emotional component to the parts of our body. Like girls, you see like videos of girls like bawling hysterically when they get their like haircut, and so like we have some sort of emotional component to like, yeah, I mean my hair's long, why do you think it's this long now? Like, but any sort of like emotional attachment that you have to your body, whether you realize that you have an emotional attachment to it or not, maybe that's that like kind of identification part that you're talking about. You're missing that like that link of saying, yeah, that feeling of like this belongs to me. Like I identify, I have that emotion connected to it. And I'm looking at the map, and when you put up, yeah, that part, and I'm looking up at it, and I'm trying to remember because it looks to me, and I can't exactly remember, it kind of looks to me like there's a overlapping part that they were talking about with Capgras syndrome, but it's really hard to tell.
It looks like the insula ought to be involved in this from where did they talk about that at all?
What's really interesting is there was only one person in this study that had posterior insula damage. Yeah, and so at I think I have it. There was maybe it's
That's one of the ones at the very end.
No.
Or did you get rid of them?
No.
So
it might be one of the ones I got rid of.
I might have the old copy here.
Actually, I don't think I put it in here because I saw that it wasn't in the article. But they talked about how the, I think somewhere they said something about how the insula might be involved in this, and that it is involved with some other sort of I don't want to say sense of self things.
It is though.
It is the sense of self, right?
The whole thing about the insula, supposedly, or at least one of the theories about it, is that it integrates all the sensory information from all the different parts of your body into a feeling of yourself. Like the feelings are somehow put together by the insula and like merged into this one unitary perception.
So I wonder if maybe it's just based off of like, maybe it's less of the emotional part as much as it is the being able to distinguish yourself from the outside world. But it is kind of strange because I thought that, but in the article it does have a table where it talks about the different parts of the brain that were damaged in each patient. And the insula was only in one of them, and it was the posterior insula. Although when I talked about the consciousness, that the claustrum is kind of it's by the insula. Yeah. So I thought that was really interesting because being adjacent to the insula, if that kind of helps, like integrating all of those sensory inputs and all of those emotions is what, if the claustrum is where consciousness, is that manager of consciousness, maybe it's getting a lot of input from the insula. Yes.
If it is like an emotional deficit type of thing that you're talking about, I wonder if not only just physical therapy, but actual therapy, like this is your leg, your leg, like let's bring it to your attention what your leg does for you on a daily. Like, you appreciate your leg.
Get on a better footing with your leg.
Just bring it to your attention, like this is a very important part of you.
Yeah, get a better relationship with your leg.
It's couples therapy.
Okay, so so go back to the takeaways. I want to just make sure that have learned something here.
That one.
Okay, so these three syndromes, or these three sets of symptoms, correspond to different areas of damage, which says something. Okay, and then, so basically what I want to pose a question for you guys to just think about. If you have anything to say about it now, that's fine too. But so what does this kind of research and these kinds of findings say about our ordinary experience? We have a sense of self that we take for granted. You know, we experience ourselves as being whole, and the world makes sense to us, most of us. Does this make you feel or think that we have, like, what does this say about the nature of human, you know, existence? Or do you feel like this makes you realize anything about how much what we think is reality and is obviously reality, how much of that is a construction of our brain? I mean, just think about that. It's like we think we're perceiving what's out there. Are we? Or are we somehow taking input and constructing something that isn't out there, that it's in here? And I think this was kind of one of the questions that was brought up in one of these videos at the beginning of the class, talking about how we're making our reality. I think this is getting at that idea that we are making our reality, but it's so profound we can't think about it. We can't get outside of it to think about it. So these folks really help us get outside of our own reality to think about it from a different perspective. So I have to say that when I first learned about the split brain people, it completely changed my philosophical take on the world. It's like, wow, yeah. These people there are two different selves in the same head with different goals. You know, and that sort of suggests that could be going on all the time, but we don't perceive it that way because by the time we become aware of it, it's already integrated. So here we see people whose integration has failed for one reason or another. So anyway, think about that while you're, you know, filing your nails or whatever.
Yeah, I thought it was interesting. There was a couple of videos where they talked about like split brain, and they showed this guy trying to do a puzzle, and his hands were fighting with each other about like where the puzzle pieces would go. And then there was also one where like they were pointing at the different things, and like on the left side of the screen, it said like apple or whatever, and the guy points at the apple, but on the left side of the screen it said walk, and then on the right side of the screen it was like an apple, and so he points at the apple, but the left side of the screen said walk, and the guy gets up and just starts walking away. They're like, where are you going? He's like, I was thirsty, so I'm gonna go down the hall and get a Coke. So it's just kind of like they don't understand. However, the command, so his unconscious self read the command and responded to the command and decided to get up and start walking away. But his conscious self is like, so then he has to make this confabulation, and that'd be like the nominalistic kind of confabulation where they are making up some sort of explanation for misunderstanding what's going on between their body and the
So that's
environment.
Clearly so you called it the unconscious hemisphere, and I know that's what a lot of writing calls it, the unconscious hemisphere, but I don't really see it as being unconscious.
Because it's responding to things. So that was that was kind of this differences, where's it at, on the conscious thing, where these two different ideas, is it separate or is it superior? So is it that they are both conscious, but they're disconnected so they can't communicate?
And one of them can't talk.
Right, and one of them can't talk.
That's the only thing that makes it seem unconscious is that it can't talk.
And there was a lot of...
But it can sometimes write, and it can draw, and it can point at things. So how can it be unconscious? You know, so then you have to think about what's it like to be a person with the split brain. Anyway, I think we're out of time, so we can go in and think about all these profound